to Behind the Best, the podcast by Fortius Clinic. Today, we're diving into a condition that sits at the intersection of elite performance and everyday life, hip dysplasia. It is something that can affect anyone, but for athletes in particular, it presents a unique set of challenges impacting performance, decision-making, and long-term health. So, to help us unpack this, I'm joined by consultant hip surgeon Marcus Banks, along with one of his patients, professional footballer Harvey Lintott. Today and together, we are going to explore what hip dysplasia really is, how it presents differently in athletes, and what the journey from diagnosis to recovery looks like. So, Marcus, Harvey, thank you both for joining us.
Thank
Pleasure.
you.
So, to start us off, when people hear hip dysplasia, it can sound quite technical. How would you explain it in simple terms, and why is it important?
The hip joint is a ball and socket joint, and hip dysplasia is really characterized by inadequate development of the hip socket. So instead of it being a nice ball sitting in a nice socket, it's a ball sitting in a slightly shallow socket. I liken it to the steering of a car being malaligned. Now, every time you have every time the car goes for its MOT, they always check the steering. And one of the ways you may realize that the steering is out of line is that there may be excessive wear on the tire. And that's how the malaligned steering draws attention to itself. With hip dysplasia, it's the same kind of thing. The hip joint is malaligned, therefore there's more pressure on certain parts of the hip socket, and that can manifest as pain and early wear of the hip joint itself.
So then, structurally, what's actually happening in the hip when someone has dysplasia?
Because the socket isn't developed properly, more load is put on the front of the hip socket. Mm-hmm. And that, again, the excessive forces through that cause pain and injury.
So then, is this something that people are typically born with? Is it a gene, or can it develop over time?
Yeah, it's definitely, we call it a developmental problem in that it can be present at birth, and actually in its worst form, it's actually, babies born with dislocated hips at birth. But quite often it manifests in athletes sort of in adolescence, teenage, 20s, 30s, that kind of age. And sometimes it's because the socket doesn't complete its growth, or it's always been inadequate, but the patient themselves haven't been active enough. They haven't put enough miles on the clock to alert them to its presence. So it can be it can be there all the time. It's been there since they're a teenager or even younger, but it's not until, if you like, they've driven enough miles on their malaligned steering before the wear on the tire is noticed.
So you obviously just mentioned that, and obviously we hear that it can go undiagnosed for quite a while. Why is that then, and especially in active individuals?
Hip pain is not normal at any age, really, and for some reason it seems culturally that young people with hip pain just have to suck it up, whereas old people with hip pain, it's arthritis or something, and it seems to be taken more seriously. But in younger people, in my experience, it's not taken so seriously, and a lot of delays in diagnosis. They may be given incorrect diagnoses. It's a hip flexor strain, it's a bit of this, it's a bit of that. But actually, what it actually is a significant and serious structural problem to the hip.
Do you know as and when it occurred with you?
For me, I probably started feeling symptoms maybe late 2023. And they were very they were mild symptoms at first. And for me, it just built up over a period of time. And then that's obviously when I knew that probably I had something more serious than I first thought.
How old were you at the time?
I would have been 21. Yeah, 21. So a couple years ago. Yeah, 23 now. So.
So still quite young to start feeling it.
Yeah. I mean, I like I said, for me, it was just the mild symptoms, and I just, as Marcus said, you can think it's something like a strain or something like that, and you sort of try and rest it and do the rehab, and for me, I'd done all those things and nothing really seemed to work, and that's when obviously I took it to the next level and came and saw Marcus.
I mean, that is one of the features of the condition, is that you carry on getting worse despite rest, despite non-surgical treatment, it's the symptoms just carry on, and they're often kind of worse than, if you like, they should be. The shallow hip socket amplifies the symptoms, and that is one of the hallmarks of the condition. It just gets worse and nothing works.
Really? Can it be quite significant?
Yeah, I mean, particularly in women, actually, it can be very disabling. And one of the problems is that these young women have very severe limping. They can't, they're leaning on the buggy or the shopping trolley or leaning on their partner to get around, and yet they've had an X-ray that shows they don't have arthritis, and so therefore they said, oh, well, there's kind of nothing wrong with you. But of course, they've got a significant hip condition. And just because, someone's been told their imaging studies are normal doesn't mean they actually are normal, because this is a highly specialized area, and the things, the signs on the imaging and the X-rays may be missed or misinterpreted. So it's very much something. Young people with hip pain is rare, but it's a specialist area.
So something to definitely consider
persist with,
having looked at if you are feeling it consistently.
Yeah, I mean, it's not normal to have hip pain at any age, let alone as a young adult.
I mean, is it normal to have pain anywhere, really, at any age?
Well, yes, exactly.
So then now we've set the foundation, let's look at how this actually shows up in different people, particularly in those pushing their bodies to the limit. So we're going to look at athletes and everyday patients. So how does hip dysplasia tend to present differently in athletes compared to the general population?
They present earlier and often more insidiously, more gradually. And going back to the sort of the worn out steering analogy, athletes basically are driving faster. And so you notice that the steering's malaligned sort of earlier than if you're, say, driving around at 30 miles an hour. If you're driving at 70 miles an hour, you'll notice that the cars are kind of a bit wobbly and things aren't quite right. That's the main feature. And the other thing is, paradoxically, because they are in a sporting environment, they may be more exposed to advice that may not be ideal, because hip dysplasia can mimic other less serious conditions. And so they may be more likely to be diagnosed instead. Again, the hip flexor strain, tendinitis, pubic overload, pelvic ring problems are more likely to be offered as an alternative, because those are options. So sometimes there's obviously much less of a delay in athletes, often with the diagnosis, but it still can be delayed.
Well, of course, because athletes in general are just more active, from an early age as well, and loading their entire body just a lot more.
Absolutely, yeah. So it presents younger and earlier.
So then what are the unique challenges athletes face when dealing with this condition? I mean, this is for both of you.
Have you met Harvey? Yeah.
Yeah, I have. Let's go.
Yeah, so, challenges. I mean, for me, as I say, it started off very mild, sort of a sort of low level sort of aching in the hip, after sessions, after games and that sort of stuff. And I think you just put it down to, at first, just being stiff, being sore from a game or from a training session. And as I said, for me, that got progressively worse. And I was initially told that I had, like Marcus said, pubic overload in the area. And it was something that sort of should be managed. So I was doing a lot of recovery stuff in the pool and that sort of stuff, trying to sort of ease those symptoms. And it did ease. But then, like I said, eventually it did get worse and worse and worse. But yeah, it was a challenge, of course, because I think it's also the not knowing. You're being told one thing, and you sort of know in your body that, is that quite right? Because I keep getting this pain. And as Marcus said, it can be sort of diagnosed as many things. And I think that's the main thing. It's the not knowing. And you just sort of, as with me, I got to a point and I needed to know exactly what it was and what was bothering me. So that's probably the biggest challenge, I'd say, yeah.
How long was that time frame of not knowing? Because your body does know when something's not right.
So for me, it was probably near to at least half to 3/4 of a season. So you're looking at maybe 6-7 months. I mean, the season that I sort of started noticing the pain, it was pre-season. So you're looking at sort of July time. I sort of was aware of it, and I would sort of have, I'd be okay for 2 or 3 months, managing it. And then it would get to a point where, right, you might need, 4 weeks, 6 weeks of just recovery and not stressing it as much. And it would work and it would feel okay. And then I'd go back to playing, at my, no restrictions in terms of training and games and that. And then it would just come back. So that's how I felt it in my journey. So, yeah.
That's how you knew something wasn't right.
That's how I knew something right, because it, as I say, like Marcus said with the rest, you think, got something wrong with me, I'll rest it, it will recover, it will repair, and you think you're going to go back and it's going to be good as new. But then when you come back and you realise it's not, and, that probably happened on 2 separate occasions. I had maybe 4 weeks out of it, thinking that it would heal and repair and on its own, and it didn't. So that's obviously why I took it to the next step, and saw Marcus and was here at Fortius.
So is there a tipping point where continuing to play or train just becomes harmful?
I mean, it just gets more and more painful and harder, and then eventually you just can't do it. I mean, as I say, and again, going back to the malaligned steering, there comes a time when you are going to crash. If you're driving too fast and you can't steer the car, you end up in a ditch. But I think in general terms, patients with hip dysplasia often are presenting for treatment. The rate of progress is quite slow in terms of damage to the joint and development of wear and tear in the hip joint. That takes, many years. And so, yes, it's not ideal. Yeah. I mean, the ideal thing is to have it treated appropriately. It does gradually cause, irreversible damage to the joint and the lining of the joint and wear and tear arthritis of the joint. But that takes quite a long time. One of the features of hip dysplasia is it's often painful well before those wear and tear changes occur, which is actually a good thing. So you've got an opportunity you've got a window of opportunity to fix it that may be years. But when you're a professional footballer, you don't want to wait years to get it fixed. You need to be, back on the field or back on the track ASAP.
So Harvey, what was your experience like getting a diagnosis and then starting treatment at Fortius Clinic?
Yeah, so as I mentioned, it got, for me, progressively worse. And to be fair, thankfully, I think I really sort of found out about it at the right time. Didn't sort of have the effects and get worse, which was great. I sort of caught it at the right time. So for me, I first of all got scans on it, MRI scans and things like that, and got a real understanding of the diagnosis. Came and saw Marcus and had appointments, and he sort of explained what he explained to everyone now, how it works and what it is and how to sort of fix it, basically. They were the sort of first steps. The main thing was just for me to understand exactly what it was, what sort of was required for me to get it right, whether that was surgery or whether that was, and sort of a plan of action of what to do next, really.
And you've had surgeries as well, haven't you?
Yep. Had 2 surgeries to sort of fix me and mend me, and and the first one was a hip arthroscopy, which was sort of, I suppose Marcus might be able to tell you more, but fixing the labrum around my hip, so fixing the damage that had been caused. And then the second surgery was actually to make, my hip mechanics new and improved, as you say. And so I had to do them separately. Couldn't do them all in one go. So they're about a month apart. But, thankfully they went really well, and I'm feeling amazing now, and I really feel the benefits of it now compared to before the surgery. You know, I feel just so much better.
How did you feel then when you were told you were about to have hip surgery or you needed it? Because I remember when I was told I needed knee surgery at 25 years old, and I mean, it just felt like my world was falling apart.
Yeah. I mean, obviously being young as well, and obviously being a professional footballer, it's they're the sort of words you never want to hear. You know, you want a injury as such free career, a surgery free career, of course you do, but you know, that's not how it pans out sometimes. But to be fair, I mean, it was obviously, you know, a shock. I did not expect it to be that bad in terms of, you know, I thought it was just a little thing that might need a little bit of tweaking or a little bit of rehab or some fancy exercises or whatever. But yeah, it was shocking. But at the same time, I sort of thought, actually, you know, it's a good thing because I'm in this pain now, and if I can go and get this surgery that's going to really help me and help me and my hip and sort of be new and improved as such, then, you know, I was all for it. So yeah.
So obviously you mentioned you had 2 different surgeries. They were a month apart. How were you during that?
Yeah, I mean, for me, obviously it was only a month, unlike your case. But for me, I think it was, you know, I was on crutches for 2 weeks after the first surgery. So it was a bit like just come off crutches, knowing that enjoy your 2 weeks of freedom before you get the next surgery. But to be fair, I think actually having the 2 probably was a good thing because one, it obviously made sure the job was done properly, you know, and 2, I think the first one got me used to everything and going into the operating theatre and getting used to the whole process. So then I think the second one, although the second one was probably the bigger one as such, it actually got me used to the whole procedure and that sort of stuff, which, yeah, obviously the first times you're all new and you're thinking you don't know what's happening and that sort of stuff. But yeah, it definitely got me used to it. And as I say, I just enjoyed those 2 weeks off the crutches before I knew I was going in for the other one. So, and also as the first one went so smoothly, it sort of gave me confidence and knowing that, you know, okay, hopefully the second one goes as smoothly. And, you know, not that I say I was looking forward to it, but it definitely gave me confidence that the first one went well and the whole process was really well done. So, yeah.
Yeah, it's an interesting way of looking at it because I think once you've gone through the worst, and I know in my case, the first 6 months were the hardest. So when I went for my second surgery, which was an ACL surgery, which everyone says is, you know, such a terrible surgery to have, but I'd been through hell for 6 months already. By the time I had my second surgery, as much as I was terrified, I think it was the easiest part. But you explained in your own words why.
Yeah.
And obviously, when you've gone through something as such a successful surgery first, it does give you the courage and hope moving forward for the second one.
Definitely.
So then when it comes to treatment at Fortius, what are the main options available and how do you decide what's right for each patient?
Yeah, I mean, I'll just focus on Harvey because when Harvey came, he was ready for an operation, weren't you? I mean, that was the bottom of it. So he came at the perfect time. So he'd tried all sorts of things and he knew you weren't getting anywhere, didn't you?
Yeah,
and
exactly.
So actually, you know, when I'm telling him I'm going to, you know, realign your hip socket and put 3 screws in your pelvis and all that kind of stuff, yeah, it you know, it all sounds pretty terrifying, but you kind of, you know that you knew that you had to have it done because, you know, he just wasn't getting anywhere without the surgery. This is specialist surgery. So effectively what Harvey had was he had initially a keyhole operation and that was to repair the labrum. And the labrum of the hip is a sort of like a rubber seal around the edge of the hip socket. And it's the thing that gets clobbered most with hip dysplasia. So say if I'd taken an X-ray of Harvey or an MRI scan, an X-ray of Harvey, you know, 5 years ago, it'd have looked exactly the same. It would have shown his hip dysplasia, but he didn't have any symptoms then. And so what's changed? Well, what's changed is that the labrum has torn because the labrum takes on more and more load until it tears. And when it tears, that's when an asymptomatic hip with dysplasia becomes a symptomatic hip with dysplasia. It changes from a painless hip with dysplasia to a painful hip with dysplasia. And that's quite an important point to make. Why has it happened now? Well, he's torn his labrum. That's why it's painful. But of course, there's no point in just fixing the labrum, because it'll just happen again unless you reduce the forces through it. And the way you reduce the forces through the labrum is by realigning the hip socket. So you literally cut around the hip socket. It's an operation that takes, between 90 minutes and, usually under 2 hours. You turn the hip socket round, fix it with 3 screws, and then wait for the bone to heal. So I always I talk about this, but it only appeals to a certain age group. We're being tough on the labrum and tough on the causes of a labral tear, to hark back to one of the comments of our former prime ministers. And so that's why one is a keyhole operation and one is an open operation through, an incision 8 to 10 centimeters in the groin. So that's the principles behind treatment of hip dysplasia, and it is specialist surgery. Say for example, just put it in context, about 100,000 hip replacements are done in the UK every year, but this realignment hip operation called a PAO, peri-acetabular osteotomy, is what it stands for. Peri meaning round. Acetabulum is the Latin name for a vinegar cup, but it's also the anatomical name for the hip socket, and osteotomy is cutting the bone. So we're cutting round the hip socket to realign it. Is probably done 500 times a year in the UK, and probably only in, maybe 10 centres nationally. We're fortunate at Fortius here, we've actually got 3 surgeons that do it here. As well as, and we actually have 7 surgeons that do keyhole hip surgery as well. So it's a huge concentration of expertise here. So that's the advantage of coming to Fortius, because you not only tap into the individual surgeons, but also the whole team here. And so there's a huge amount of experience within the organisation at dealing with this, and dealing with young people with hip pain. They've got jobs, they've got children, they've got sporting careers, all sorts of things to deal with. So it's helpful that the organisation, not just the individual healthcare practitioners, are familiar with young people with hip pain.
I love that as well. You said, it only takes about 90 minutes, 2 hours. It's not long at all.
You got to practice, so haven't you?
Of course.
I've been doing that for some years now.
So are athletes able to return to their previous level of performance afterwards?
Yeah, ideally, yes. You haven't you?
Yeah, definitely. Feel better from it, actually.
Yeah. It's interesting, isn't it? The thing is when I'm asked that question, I just say, well, look, you're not playing now, are you? So it's that's, I'm afraid, that's the blunt reply to it. One always aspires to that. And if it's caught early enough, and if the treatment goes smoothly and no complications or minor complications and stuff, then yes, that is something. One of the problems with dealing with professional athletes, obviously, is the time scale, and what time in the season the injury happens, and if you can get the player through the season and then maybe do it in the off season, but the trouble is it's sort of 6 months off having this kind of stuff, isn't it? It's proper bony surgery, it's not a bit of this and that. It's proper surgery. So you do, it's a 6-month block that you have to allocate for that. But that's always the hope. That's always the hope and expectation, and often the reality. But there are sort of unknown unknowns that can always affect outcomes. So but in theory, yes, if it's treated appropriately and early enough.
Harvey, do you think you've come back stronger?
Definitely, yeah. Like Marcus said, I think it was very good that I caught it at the right time, and I definitely feel now that almost new and improved. I feel like I genuinely just feel, if you compare sort of how my body and my hip was feeling before the surgeries and that sort of stuff to now, it's a world difference. It's amazing. I feel just even better, and it's great that like Marcus said, thankfully mine went so smoothly and without any complications, and just really thankful for that.
It's crazy to think that for so long you had absolutely no idea what was going on inside your body, and I mean, now you do. You've had operations and everything.
Yeah, it came as like I said, it came as a shock, because before, maybe 6 months prior to the surgeries, I touch wood, had nothing in terms of injuries, anything muscular, anything anything. I was totally injury free and hadn't had a single hadn't missed a single game through anything like that. And then obviously you get told that, and it's like, well, you got 6 months here where you're not going to be playing, and that sort of stuff. And I think the main thing, I think obviously the physical side of it and the rehab is obviously tough, but the main thing is mentally. I think going through that and knowing you're not playing, and obviously thankfully we know that now, that I came on the other side better for it. But at that time, you don't know that, do you? You don't know the future, and you don't know how you're going to come out the other end. And I think that's the main thing for athletes. It's mentally. And I got back to training, and I think as maybe the person I am, but you sort of think, right, I've been through this, right, I'm going to go, and as soon as I'm back, I'm going to absolutely smash it. But then you realise, you get there, you get back to your first session, back training, and you realise, actually it takes time, and sometimes you want to rush these things, especially as an athlete, because you just want to get back to your sport. But I think you've got to realise, and anyone watching who's going through the same thing, it takes probably more time than you think. You've been told, right, 6 months out on the sidelines, you've done your 6 months, you're thinking, here we go, like, I'm back. But then you train, and it's like, right, okay, that's one step, and the next step, and you have to take it a step at a time. But as I say, thankfully for me, I feel definitely a lot better from all that, mentally and physically. So yeah.
So then you're touching upon the mental side of things. What was your recovery like, not just physically but mentally? How did you continue to push yourself through?
If anything, it really strengthens your self-belief, because as I said, you don't know what the future holds at that time. You're on crutches and all them sorts of things, and you going through your head, you're thinking, am I going to come back the same, and all this sort of stuff. I think mentally it really makes you sort of a lot stronger. It did for me anyway, because you sort of have to just focus on a step at a time. I think that's the thing for me, rather than sort of looking 6 months into the future. You have to go, right, what's next? And for me, it was like, right, okay, I've got however long left on crutches, focus on that. Right, now you're off crutches. Okay, then what do you need to focus on? You need to focus on, building the muscles around it up stronger. And it really, helps you realise and helps you take things a step at a time, rather than just seeing it as 6 months' time, I'm going to be doing this, So definitely.
Was there a lot of fear involved, thinking, what happens if I never get back to football?
Yeah, of course. And I would be lying to say there wasn't, anyone would think that, especially but just before the sort of the symptoms started occurring, I'd actually probably had my best season, and I just got promoted to a new league, and probably had my best season as a professional that year, and then the next year to sort of, you want to really kick on, and you want to go, right, okay, I had a great season last year, I want to go and kick on and go even better this year. But then when those symptoms start coming, it can it takes a lot of mental strength, and for me, I genuinely believe that it was sounds weird to say, but I genuinely think it was probably definitely for the better. Some people will go, obviously don't want surgery, but at the same time, as I mentioned previously, it was actually, again, strange to say, but it's actually a bit of a relief, because I could sort of put a picture in my head of, right, I'm having these symptoms. Okay, I know what it is. I know what, I'm on crutches for this long. These are the exercises I'm going to be doing when I'm back off crutches, and I'm going to come out stronger for it. And that's what I try to focus on. Yeah, definitely.
Does everybody need to have an operation, or do some people don't? That's a very big question, I know.
Yeah. I think that, if you're getting disabling symptoms in your hip, because you've got hip dysplasia, then you kind of do need an operation, yes. It's a question of when, and by and large, the hip has to, to have realignment surgery of the hip, the hip has to be good enough. And also the patient has to be good enough as well. So it's very much sort of young patient sort of centered. 40 is sort of usually considered, the general sort of upper age limit. But it depends what people have got going on in their lives. Some, a 55-year-old female marathon runner, would still potentially be a candidate, whereas someone who's, a bit younger, maybe got a busy job, and lots going on in their lives, they may not be able to take the time out, because there's no doubt that the rehabilitation from, say, hip replacement surgery, which, is how you treat hip dysplasia in older patients usually, or if the hip has already started wearing out significantly, the rehabilitation is easier. So I think that, deciding sort of what operation and when, is part of the skill of managing it. But, the problem with it is it just keeps getting worse, and you can buy yourself a bit of time with rehab. There's no doubt that strengthening your core, strengthening the muscles around the hip, reducing your non-impact activities can make it feel quite a bit better, because you put in the mechanism to stabilize the hip, but they'll only get you so far. They may help if you've got very mild dysplasia and mild symptoms, but if you what I call proper hip dysplasia, it isn't going to work, and that's one of the difficulties in managing this, and it's sometimes it can take patients a while to figure that out themselves, and that they actually do need something doing. So, as I say, the decision making is quite difficult, and these are not the kind of consultations you can have in 5 minutes. And also it's a family condition as well. So I mean, actually, the majority of patients with hip dysplasia are actually women. It's about 7 or 8 to 1. So, Harvey's actually unusual. And one of the reasons I was keen to get Harvey along is that, boys get hip dysplasia too. Because if you look online, there's massive, information out there, isn't there? But it's all girls, isn't it? I mean, hip dysplasia is a family condition. It does run in families. But also, of course, the sufferer, the patient, his or herself, needs the support of their family as well. And so, if ever I meet a patient for the first time, make the diagnosis, next time they come follow up, say, bring someone, because, I want to know them as well as you, because, we're all in this together kind of thing. And I think that's a really important component. The other thing, young women in particular may have been diagnosed with it when they were born, or and may have had some treatment for it when they were children. And they may have been fine during adolescence, teens, early 20s, and then the symptoms return. And that's usually because despite treatment in childhood, the hip hasn't quite developed well enough. And so it's sort of, if you like, it's back again. And, and that can be quite complex, because obviously, the parental guilt is all back. Oh dear, this is all going on again. That's a whole thing. So, I'm helping manage the parents, manage that as well as the patient themselves. But I mean, that is an element of managing hip dysplasia. It's a family condition.
Well, Harvey, in your case, it sounds like you're always going to need an operation at some point. So I guess better to get it out of the way earlier.
Yeah, and like I said, that was the thing at the time. I knew that, as Marcus said, the symptoms kept coming back even after strengthening, after rest, whatever it was, they would come back eventually. So as I said, it was a relief to get the surgery, because I know, right, get the surgery and it's out the way, and you're new and improved then, rather than thinking, is this going to come back? Is this going to come back all the time? It's it was the best thing for me. So
exactly, after a surgery, just think of yourself as new and improved.
Well, yeah, exactly.
You're a new version of yourself.
Yeah, exactly.
And then, Harvey, what would you say to other athletes who might be going through something similar?
I would just say it's obviously very individual to everyone's journey, but for me, I think, just to be a bit, don't rush it. I think, you want to, as I said previously, you want to get back to your sport quickly, and, all that time that you're out injured or whatever you want to call it. To be fair, it's not, I wouldn't even call it an injury. I think it's more of a condition, as Marcus said, and a condition that's, for me, was fixed. But no, going back to your point, the thing I think is mentally, as I mentioned, it's you probably need to give yourself a few more extra weeks than you probably thought, especially when you get the time frame, and not to be too concerned by the time frame. If you get told, right, 6 months, for me, I was like, right, mark that date, I'm back like 6 months from now, but you get to realize going through that process that actually that's sort of a guide, and you have to then, once you're back in terms of like doing things again, you then have to build up the muscles, build up obviously your fitness again, and those sort of different things. And I think the main thing I'd say to people is just sort of to just not rush it, and to sort of understand that it is a process that needs to be taken step by step. Yeah.
The key is definitely not to rush it. I remember even after my second surgery, when I was back in my rehab and, slowly progressing and getting to the point where I was lifting specific weights, and I was kind of getting restless and I wanted to go heavier and heavier. And I remember speaking to my physio, and I was like, oh, come on, like, let me add 10 more kg. And he was like, absolutely not. I was like, but I can do it. He was like, you absolutely can't. He was like, your mind thinks you can because you're getting bored and restless. He goes, but physically you cannot do that yet. And it was a really hard lesson, and it stuck with me to this day, which was, why ruin something short term just because you want it right now? He said, really think about the long term here. Don't rush it because you want it now. Really think about this properly. And it stuck.
Yeah, definitely. I'd agree.
Yeah, it's a hard one, but it sticks.
Yeah, definitely.
So then before we wrap up, let's make this really practical for anyone that is listening. So what are the key signs or symptoms that should never be ignored?
Well, it's sort of hip pain, really. And classically, it's felt in the groin, actually, and literally, patients come in pointing to their groin. It's there. They're pointing at their hip joint. They're pointing at their labral tear. It's not, and again, it's not normal to have hip pain. It's progressive. It's causing you to limp. You can't keep up with your friends when you're walking around. You may be reaching for painkillers. You may feel instability in the hip. And it's just a progressive loss of function, and you have to give up running. So you give up running, and then you use the cross trainer more. You find that painful, then you're just stuck with the bike. Not that there's anything wrong with being stuck with the bike.
Hey,
however,
I use the bike.
Like I spend my life on the bike, but it just don't ignore it. Now, of course, it has to be progressive. It's progressive, and obviously, if anyone can tweak their hip over a weekend, but if it kind of keeps coming back and it starts to affect more and more activities, initially it's just when you're running, then you realize it's starting to creep in when you're walking, and then it's actually limiting your walking, and then actually it's getting in and out of a car or sitting. It just gets more and more intrusive. And, it's really important to kind of get some kind of opinion on it. If, you're getting symptoms for sort of, 6 months and beyond, I would thoroughly recommend people, saw physiotherapists, because they're very helpful in the early management of these things, and they'll deal with the things that'll get better by themselves, if you see what I mean. But if you've got a significant structural problem with your hip, it won't. And also, it's an opportunity to strengthen the hip as much as possible, even in the run up to definitive treatment.
So then, if someone suspects that they might have hip dysplasia, what should they do next?
What should they do next? I mean, again, the risk factors is mainly girls, but boys get it too. And if it runs in the family, the risk factors are firstborn, female, breech, multiple births. So if you're a twin, and also neuromuscular disease as well, particularly cerebral palsy. So they're all sort of risk factors that you may have. There may be a history of treatment of it in childhood as well. So they're all things that you think, yes, I may have hip dysplasia, because people can get hip injuries without having hip dysplasia. You can still injure your labrum, that rubber seal thing around the edge of the hip socket. That can still get injured for other reasons, hip impingement and even just bad luck. So, I mean, the key thing is to see someone who you think can diagnose it. And obviously we've got a plethora of people here. Scans don't always tell the truth. Actually, the best way of diagnosing it is actually with an X-ray, but the X-ray has to be interpreted properly. Someone has to be open to the prospect. So again, sometimes patients are told, "Oh, your X-ray is normal, your scans are normal," and they've got rip-roaring hip dysplasia. This is something that definitely turns up. Whole swathes of the UK and Ireland don't really have any treatment don't have any service for hip dysplasia. As adults. It'd be to talk to GP, say, look, this really isn't going away. Can I, see a specialist to see what's kind of going on? Because, all my activities, can't do park run anymore, and quite a lot of my social life revolves around, I don't know, playing paddle or playing volleyball or having a kickabout with my mates at the weekend, and if those things are sort of, and not possible, and of course exercise is such a big part of so many people's lives, that, part of our job, I view my job is, and also sort of mission statement of the organisation, really, get you back in the game, whatever that may be, and whatever that game is, and whatever age or background you're from. So, I mean, that's my advice, really. Take it seriously. It's not, you're not imagining it.
Well, I think that's what the important thing is. And even if you've gone elsewhere, let's say, and you still feel something's not right, I mentioned before, your body tells you when something's not right. It really does. And listen to that feeling and properly, have it looked at. So then, Harvey, to finish, if you could sum up your experience at Fortius Clinic in one sentence, what has this journey taught you?
I mean, Fortius, for starters, have been amazing. Marcus and his team, were amazing. That's the word I'd use for it. Very professional, very just, and not just, they really. I didn't feel just like another patient. It's personal, and I got made to feel like Marcus and his team, really cared about me as a person, rather than just another number or another statistic. That's how I felt, and I just, as I've said, Marcus, just want to thank you and your team for what a great job, and the whole everyone at Fortius has done for me. So yeah.
It's interesting. I actually agree with your statement in my own ways with what I've been through. Obviously, it was with my knees, but it was an extremely personal experience, and I wasn't felt like a number at all. I actually agree with you. It's my experience with Fortius was also amazing. So it's a nice way of putting it.
Definitely.
So Marcus and Harvey, thank you both for sharing your insights and your story with us today. And thank you to everyone for listening to Behind the Best, podcast by Fortius Clinic. If you found this episode helpful, be sure to engage and share it with someone who might benefit from it. And to everybody here, thank you very much for listening. We will see you next time, because behind the best, there is always more for you to discover.